Good afternoon. There were 8 new cases of COVID-19 in the Northern Territory overnight. 6 of these were linked to the current cluster. The total case count for that Katherine East cluster is now 100. The 2 unlinked cases were 2 resort workers in Yulara, and I'll detail these shortly. 2 of the 6 cluster cases are people who are currently in the Centre for National Resilience. They are known close contacts from the Katherine East area. One is a female in her 30s, the other is a male in his teens. They are in low risk to the community. They were in the Centre for National Resilience. 4 of the new cases are from Tennant Creek, and we have already launched a major public health response to deal with these. 1 is a woman in her 40s. She tested positive at the Tennant Creek Hospital yesterday, and the results were confirmed overnight by our laboratories. She is unvaccinated. She has links to the Katherine cluster. She was infectious in the Tennant Creek community, and in particular at the Whopper camp since around Sunday. There are now 3 other positive cases from Tennant Creek. These cases are a woman in her 40s, a female in her 20s and a child. We have already begun the contact tracing for these cases. This is a serious situation. Tennant Creek is a major transit centre. There is a vast amount of movement in and out of Tennant Creek. The timing is also complicated, given many people are about to or have already started their Christmas leave, their school holiday travel. The vaccination rate in Tennant Creek is 83% first dose and 70% double dose. This is frustratingly low, disappointingly low. We also know that the Barkly regional vaccine rates are amongst the lowest in the Territory, which makes the region more vulnerable. We are therefore implementing the following measures for Tennant Creek. Tennant Creek has already gone into a lockdown and will be in lockdown until Monday the 20th December 5 p.m. The people of Tennant Creek are only permitted to leave their homes for the 5 reasons. And to remind people of these 5 reasons, they are: 1, medical treatment including getting a COVID test and, importantly, getting vaccinated. 2, for essential goods and services like groceries and medications. 3, for work that is considered essential and can't be done at home. 4, for 1 hour of outdoor exercise a day within 5 kilometres from your home, which is pretty easy for Tennant Creek, with 1 other person or people from your house. 5, to provide care and support to a family member or a person who cannot support themselves. This is Tennant Creek's first lockdown. I want to assure everyone that going to the supermarket to get supplies is one of the reasons, and there is no reason to panic buy, but please, only 1 person at a time leave the home once a day to go to the shop to get supplies. And I want to assure people again that supply chains are guaranteed and assured. In addition, we have already surged into Whopper camp. We will test everyone in that camp today, and eligible people will be offered vaccines. We are also implementing a direction to anyone who has left Tennant Creek in the last 7 days. You must isolate and get a PCR test. You must remain isolated until you receive a negative result. We know that many people have already started travelling for the school holidays. We know this is inconvenient, but it isn't optional. If you've been in Tennant Creek since December the 10th, it is a CHO direction that you must isolate and get a PCR test. Testing is a crucial weapon in slowing down the spread of COVID across the Territory. In addition to this, we will also be putting in a mask mandate for the Barkly LGA area until 5 p.m. on Monday. This mandate will apply to all communities in the Barkly region, in terms of people transiting through Tennant Creek, you are permitted to stop and fuel up. But don't spend time in Tennant Creek, get what you need and keep transiting whilst it is in lockdown. I will now go back to the 2 Yulara positives now. They are males in their 20s and are close contacts of a recent positive case in Brisbane. They received notification that they were close contacts of a case while in transit to the Territory. They are both double vaccinated. After receiving the notification that they were close contacts, they took the point of care test in Yulara, which came back positive, and this result has now been confirmed. They were on a Jetstar flight JQ667 from Brisbane to Yulara. There will be close contacts from that flight, and that work is being done to determine who they are, and they will be contacted. At this stage, we believe the risk is very low. To testing. There were 3,015 tests conducted across the Northern Territory yesterday. Of these, more than 400 were done in Katherine, so another massive day of testing in Katherine, and I want to thank the Katherine community because they have gone out, they've gotten tested and they have gotten vaccinated. The first dose of vaccine rate in Katherine is now at 93%, and this is huge. The double dose rate is now at 89%. This gives the community the best protection that they can have, and I can't applaud the people of Katherine enough for their great work of going out and getting vaccinated. There continues to be positive wastewater in Katherine East. Our health advice remains that masks remain an important tool in fighting COVID in Katherine. The mask mandate will remain in place in Katherine until 5 p.m. on Monday. And again, I ask the people of Katherine, I know it is an inconvenience to them, but to stick with us. This is about getting on top of that Katherine East result and that cluster there and getting you through to Christmas. We want to make sure you have a great Christmas. But again, thank you to the people of Katherine. Timber Creek and Kowkarinji are also under lockout until 2 p.m. today. A mask mandate will remain in place until 5 p.m. Monday. Both of these communities have been spectacular in the way that they have dealt with our teams. We have tested a lot of people and we've had no further tests back. So they will come out of that lockout from 2 p.m. today, but a mask mandate will be in place for those communities until 5 p.m. on Monday. To our Katherine West communities and to Barunga and Beswick, you will be remaining in a mask mandate until Monday 5 p.m. as well. So those communities that already had a mask mandate in place, so Bulla, Largemanu and Pigeonhole, you are going to be staying in a mask mandate there. We thank you all for your brilliant cooperation. The feedback from the Commissioner is that these communities have been A+ in terms of the way that they have worked with our teams and the Katherine West teams on the ground. So we now have a mask mandate until 5 p.m. Monday for Tennant Creek, Katherine, the surrounding communities of Katherine, the whole Barkly LGA. We know it's hot, we know it's sticky, we know it's uncomfortable, we know it's a harsh climate to have to wear masks in, but masks work. Masks are one of our best defences. We also know that it's close to Christmas. We ask you to please stick with us for the next few days. It helps ensure that we can all have a happy and safe Christmas with your family and with your loved ones. So please do your bit, wear your mask until 5 p.m. on Monday. There are now 163 close contacts. Of these, 136 are in isolation and 130 have received a negative test. Finally, I need to talk about Queensland because there were 16 cases in the Sunshine State today. They are reasonably widespread across the state, with cases in southeast Queensland, the Sunshine Coast and North Queensland. We are asking for cooperation from anyone who is arriving into the Territory from Queensland. Anyone entering the Territory from Queensland are being advised that they should take a rapid antigen test upon arrival. We will be making those available at the airport. And of course, if you are symptomatic, get a PCR test. I'll hand over to the show in a minute, but before I finish, I just want to again stress that we are coming into Christmas and people are taking well-earned breaks. Territorians have been doing a great job over the past 2 years, and we ask people to keep doing their part to keep us all safe. If you are in an area with a mask mandate, wear a mask. If you're transiting through Tennant Creek, only stop for essential purposes. If you are symptomatic, get a test, and most importantly, make sure you are vaccinated. Get that first vaccine, get that second vaccine, get your booster, please get vaccinated. I'll now hand over to the Chief Health Officer.
Thank you, Minister. So the first thing is, as I said a couple of days ago, this is 2 years. And here we are. We're on the cusp of solutions, and that is vaccination for preventing serious harm and minimising death. But the public health emergency, which we still are in, continues. And the main aim of that public health emergency, supported by other teams and particularly by the Commissioner, is to achieve safety for all Territorians, particularly, and those who come here too. So the partnership through multiple agencies and teams, individuals, and also other partners in the community-controlled sector is how we've got this far. But I want to particularly thank Dr. Payne, who's going on some well-earned leave, and I had my well-earned leave and I'm ready to go with this part of the challenge. So for me, this is the biggest part of the challenge for myself and you as the community. I think that we've recognised how infectious Delta is, and particularly how virulent in terms of the harm that it does. And the fact that actually people can be double vaccinated and still catch the virus actually is a reality. But having said that, vaccination prevents serious harm, minimises harm and death. So in the public health approaches that we've taken already so far, and these are reflected in the public health orders or directions, they need to be proportionate, they need to be defensible. We want to be transparent in what we're doing, and for small teams and a very small number of teams in the Territory and a large geographical area, we have to also be agile and responsive. And I believe that that's what we've done in the last few days. It's been the ability to identify cases through testing, contacts being isolated, and we're asking you to come along this journey with us. So I want to say, yes, we've got some easing of controls at the same time as some new controls. And this is the reality. As said before, there's no rule book about this. The virus continues to spread, and it's spreading further than we thought, but with a lot of connections. So I'm going to say that these incursions could continue, but the best thing that you can do is actually get vaccinated. And let's be very clear that in the future, there's going to be controls for people who are not vaccinated. There might be certain venues or certain activities where you're not able to go because of risk of spreading COVID-19 unless you are vaccinated. So let's come along the journey together. So some of the controls are rather unusual, and the Barkly LGA is a very large area and of small communities and some larger. But to those people, I'm going to say yenga kapata kamara nankara, alagan, gabawanmu. So this virus, it's a cheeky virus. The vaccine is safe. Alagan. Please get vaccinated. All you Yulara mob, Madra, you get vaccinated, please. You come with us, and also please understand that things like mask wearing, such a simple thing, physical distancing, hand hygiene, are also really useful. If you don't understand, then go and speak to the clinic. Clinic mob will tell you a straight story, true story about this cheeky virus. They'll be able to supply you with a mask. So I think that we need also together to accept now and in the future personal responsibility for ourselves and the people around us and the broader community. And that's going to be the way it is with COVID-19 continuing. And yes, we've got other variants of concern that we'll need to deal with. But let's start now. Personal responsibility, not just with the vaccination, that's really important, but just our behaviours, being aware of others. Have we seen people for a very long time, haven't seen them rather, then there needs to be consideration of what you'll do and what you'll ask them to do. If you're near somebody and they're too close to you, politely ask them to move away. If you see people not using a check-in app, please remind them that this is our rule. So there are some rules, and we hope that these rules will be proportionate to what we need to achieve. And monitoring through wastewater and testing in the community are all of the things that we use in terms of the science, the data, the epidemiology. So come along with us for the journey and take your own personal responsibility. Thank you.
Good afternoon, everyone. To Tennant Creek specifically, it is a lockdown. That means movement will have to be minimised. There is only the 5 reasons to move. What does that mean in practical terms in Tennant Creek? Restaurants will not be open for patrons to come and sit down to have a meal. They can provide takeaway meals only. The movement should only be for essential requirement. Don't send 5 or 10 people from the household to the supermarket. Only send one person to get what you need over the next 72 hours. If you are not a bona fide resident of Tennant Creek and you reside interstate and we're transiting through and you've been caught up, there is an application process so that you can apply to leave following a negative test. So similarly to what was in place in Katherine, go to the coronavirus website. That will give you the appropriate information to deal with. Mask mandates. We will be enforcing the wearing of masks. We need to make sure that people understand how important that is. Again, as we've done in every lockdown and lockout, we will have an education first approach. But if people are belligerent and simply non-compliant, then we will move very quickly on that particular individual. We don't do it for any other reason than it is the most sound health and clinical advice to protect you and to minimise any transfer that you may have in the event that you are asymptomatic and COVID positive and you simply have no idea that you are. Road checkpoints have been established north and south of the town. Road movement within the Tennant Creek Township. Don't be surprised if we pull you over to engage to understand whether you are moving around in compliance with any of the 5 exemptions. A lockdown applies to all. There is no differentiation between being vaccinated or unvaccinated. The intent of the lockdown is to minimise movement. So please help us to help you. Testing is a critical part of what we need you to do. Vaccinations is the more critical part that we need you to do once you've got your test. The vaccination will allow us for any potential future issues for Tennant Creek to contemplate lockout. But on the numbers before us at the moment, that's simply not realistic, nor practical, nor in the best interests of the Tennant Creek community. To the Barkly communities and homelands that rely on Tennant Creek, please avoid Tennant Creek if you can. Only go in if it's absolutely essential. Please seek other alternative sources if you do have availability to them, be it roadhouses up and down the highway, but do your utmost best to avoid Tennant Creek if you can. Residents of Tennant Creek who are currently outside of Tennant Creek who are seeking to return can re-enter, but they must observe the lockdown once they are in Tennant Creek. Our fervent intent, which is similar to what we've just seen occur with Kalkaringi and Dargaragu and Timber Creek, is that 72 hours with full cooperation from the community, with strong TO guidance and support of all of our efforts, we would hope to be able to get you into a similar position. It really is up to you as the residents of Tennant Creek to come forward and help us as we all drive very, very firmly to help you. To Kalkaringi, Dargaragu, Timber Creek, congratulations on what can only be described as a stellar collaborative effort. The work that's occurred on the ground across not only the Katherine West teams, but the whole community, the interoperability of all of our agencies, the inclusion of the Australian Defence Force personnel, another fantastic achievement in very, very trying conditions where everyone understood the purpose, the intent and the reasons of why we were there. It's an absolute testament to you that you got the message, you cooperated and you've got yourselves into the position you have. But please, again, the mask mandate is in place until 5 p.m. and I would also urge that you minimise movement into Katherine and other surrounds. Only travel at the moment if you absolutely need to. And I think that's a broader message for people to take away. We know that with Christmas looming, many Territorians are going to be leaving the Northern Territory. I would urge all of you to make sure that you are keeping track of our public messaging, because as we've seen in recent times, COVID positive cases can turn up anywhere in the Territory and you may need to be caught up in isolating and testing depending on the information that comes before us. So do your bit for those places you're travelling to, do your bit to help with the Northern Territory as we continue to actively target and isolate COVID to the best of our ability. There's much work to be done between now and Christmas, but our intent is, if we have the continuing cooperation we've seen to the levels that we have and compliance increase and people continue to come forward who are unvaccinated to get vaccinated, then we should all have a very Merry Christmas. Thank you.
Acting Chief Minister, there were 5 cases of Omicron in Queensland today. Those 2 cases from Yulara, they're a close contact of a case in Brisbane. Do you know what variant of the virus they're a close contact of?
No, we don't have that information at this stage.
How many tests were done in Tennant Creek in the past 24 hours?
I'll have to get those numbers back to you, but we had seen an increase from the dreadful 5 that we saw when we initially asked for the mask mandate. In recent days, I think we've been around the 100 mark. So people have been coming forward and getting tested. We have seen an improvement, but now we're really asking the people of Tennant Creek, any symptoms whatsoever, if you are then being a close contact or if you see exposure sites come up that you're concerned about, get tested. We're going to make sure that we've got the testing resources there to help support the community. But most importantly, my message is to those who have not gotten vaccinated or are still due for that second dose and haven't done it, go out and get that done as quickly as possible.
Will there be changes to the border opening on Monday, considering the surge in numbers in places across Australia?
No.
What time yesterday did that 40-year-old woman or woman in her 40s in Tennant Creek first return a positive result in hospital?
We were dealing with it yesterday around the middle of the day. We had to go verify that test, and it's really important that you do get that confirmed. After we first got notice of this individual, the actions and the teams behind closed doors in the EOCs had actually already started work preparing for a worst case scenario, which we have seen come out today, which is a positive. So once we had that result absolutely confirmed, we had all our teams ready to hit the ground and swing into action because we'd already done the preparation work.
On the borders, we've been told many times that there's no certainties when it comes to COVID. The Chief Minister has said as such. Why are you ruling out not changing border rules when we could see 25,000 cases a day in New South Wales?
We have to learn to live with COVID, but what we're doing as a government is making sure we slow COVID as much as possible, while we still have some people who have not gone out despite having a long time and plenty of opportunity to go and get vaccinated, because again, it is proven it is the best protection against COVID. But if you have a look at the testing regime that we have in place for December 20 and the conditions we have to enter into the Northern Territory, they are strong. They put good protections in place to make sure that where we can isolate someone who happens to have COVID, that we catch them as early as possible or stop them from entering into the Northern Territory in the first place.
Why do you think the vaccination rate in Tennant Creek is so low?
We've heard a range of different stories and feedback. I might actually get the Commissioner or Dr. Heggie to speak a bit about their experiences of when they went through and visited many of these Barclay communities just a few months ago. But it is very disappointing. We have fantastic government health services in Tennant Creek. We have a fantastic Aboriginal community controlled health organisation in Tennant Creek. We've been doing all we can in language, in education, talking to people, helping people understand the benefits of vaccination. However, it's been very slow going in Tennant Creek, despite the warnings that COVID is coming, and the Barclay region. I'm calling on people, don't muck around. Get your vaccination done. Get it done now. It is going to be the best protection for you, for your loved ones, and for your community. But I might hand over to the Chair or the Commissioner to speak a bit about their experiences talking to people in the Barclay.
Yes, I'll start. Thank you. The Commissioner and I did a couple of months ago go and visit a range of communities and a range of languages, and the Commissioner and I can speak complementary languages, and that was useful. If I said, first of all, the misinformation that was being fed through social media, we believe, emanating from the United States, and also faith leaders, again, emanating from Pentecostal churches in the United States, about all of the side effects, the alleged claims of how it will affect you. So that's all rubbish. And I want to be very clear that the evidence around the world is that we have got our safe vaccines. They've been approved, and also I'm going to say this, in the United States they are dealing also with catastrophe in terms of their COVID outbreaks as well. And I'll let the Commissioner add to that.
I think it's fair to say that unfortunately there was a lot of misinformation out there, and that was blurred between faith belief messages that was going across social media and quite a bit of targeted fear. We also had some levels of misunderstanding and, again, perpetuating myths that this was a non-Aboriginal illness and not one that Aboriginal people would be susceptible to. I think our experiences more recently have categorically shown that that is just simply untrue. And unfortunately, we have someone now in Tennant Creek who is symptomatic and quite unwell and being transferred to the Alice Springs Hospital. I think now the population of the Barclay have a very, very clear line of sight that this can be very, very detrimental to their loved ones, their family and their friends, and we really do urge them to come forward. And I think it's validated all the conversations that the Cho and I had with them, and as we said to them up front, we're not on social media, we're here in front of you physically and we're telling you the true story.
With regards to the cases in Tennant Creek, they've been linked to the Katherine cluster directly. Did someone from Katherine travel to Tennant Creek?
The early advice we've got through the contact tracing is that one of the individuals at least was in Katherine within the last 2 weeks and travelled back to Tennant Creek, and then obviously presented yesterday. An initial presumptive test came through that was positive. I should note that there was another individual that presented yesterday where a presumptive test turned positive. We then did further tests. That person was extinguished as being negative through further tests. What we then did was ensure that the PCR tests were obtained, and those samples were taken overnight to the laboratory, and the test results came through this morning confirming the positive result.
Do you know how many people in total
I don't have the total number in hospital.
No.
No.
I was only aware of 2. Yep.
Does that include the man who's going to Alice Springs Hospital, person who's going to Alice Springs Hospital today? Is that one of the 2 people in hospital?
Yeah, so my understanding is we've got a number that are COVID positive but asymptomatic, and of course we hold them in the Centre for National Resilience or some approved alternate quarantine arrangements. But fortunately at the moment we are down into the single numbers as it relates to those who are appearing to be quite unwell.
There's a few places to get food and some essential services in Tennant Creek. What's the plan if those places get listed as exposure sites or their staff gets infected?
I think where we're very fortunate here is that we moved to a mask mandate in Tennant Creek relatively early, and the principles have been well and truly in place. All of those places would have already had COVID management plans in place, and I think even my own memory of going into the supermarket and the service stations in recent times, they've all had hand sanitizer at the entrance, they've had the check-in code in place, staff have been able to maintain appropriate distancing and having worn masks throughout that period of time. We think that's been relatively well mitigated. Our broader experience at the moment in the Territory is that the very close contacts seems to be the heightened point of transmissibility, and so hence we continue to try and make sure that we're targeting the close contacts to the source cases, particularly with those they reside with.
You mentioned at the end of your speech before that if everyone does the right thing now, they can have a good Christmas. How confident are you that that will happen?
Well, I think we've always got to have a little glass half full, particularly this time of the year. I think what we've been able to demonstrate throughout, though, is when we've acted and moved swiftly, we've been able to isolate the coronavirus within certain parts of the Northern Territory. The challenge has been that Katherine has been persistent. We've got the final listed close contacts out of Katherine yesterday from that Katherine East zone. We're hopeful that with all the compliance that we've seen generally across that population, that the wastewater sampling over the weekend should be able to give us a fair indication whether we've actually been able to cut COVID out of Katherine or whether there are still some people that remain. But again, we just simply urge that we've seen great cooperation, and if you are feeling unwell, come forward, but continue to wear the mask for this intervening period of time. We remain very hopeful that that might realise some really great news for Katherine on Monday.
How confident are you that you can drive COVID to zero in Katherine, given the sustained community transmission in that town?
Well, I think we've got to be upfront that our intent has never been to try and drive it to zero. It's just a fortunate position at the moment where it appears that where we tried to isolate and identify that it was in a particular group of houses, and that was continuing to come through the contact tracing. It identified those linkages to people and the familial ties that they all had, that we have been able to align that more particularly to the Bicentennial Road wastewater result, again which is linked to the Katherine East area, and most of the other areas are not showing levels of consistency of positive cases. So given that we had lockout in provision, that meant that there was minimised movement for the unvaccinated. So again, we can only say that whilst we're not aspiring to eliminate completely, that may be one of the pleasing outcomes of how effective our strategy's been and how we've responded to Katherine.
You've spoken, and the Chief Health Officer has spoken about the damage that the misinformation on social media has done. I know he's indicated some of it coming from the United States, but I'm sure everyone here's seen plenty of it coming from within the Northern Territory as well. Is there anything police can do about that misinformation on social media? Do you have any power to address that?
No, unfortunately, much of it doesn't meet a criminal benchmark. We've tried to ensure that we've got some level of surveillance going across some of that messaging and try to work more broadly through our public information group to be able to extinguish some of that mischief. It is a sad reality, and I think I've been quoted as saying it before, social media really is not your source of truth unless it's coming from your mainstream bona fide media outlets or direct from the government in respects of the messaging that's coming through. That's what I would continue to point people to. Again, these conferences that we hold to try and make sure the appropriate information goes out, and the Chief Health Officers have never wavered from the clinical and medical information that's been put in the domain.
Last couple, please, guys.
Do you have an update on how that major crime investigation is going into how COVID got into the Territory?
That's continuing.
And do you have an update on, we spoke a week or two ago about your investigation into threats that have been made against the Chief Minister and others?
My understanding is further statements have been obtained and the teams are now consolidating those into briefs.
Do we know how many people that woman in her 40s in Tennant Creek lives with in that town camp?
No, that initial inquiry is occurring, but what I can say is we've surged our testing team into Wappa Camp this morning. We anticipate to be able to get that information relatively quickly through the course of the day. And of course, what we will likely do is if they're identified as being close contacts, we will facilitate their transfer into either the Alice Springs Quarantine Facility or the Centre for National Resilience.
Do you envisage at some point in the near future the need to continue transferring people to Howard Springs or Alice Springs for quarantine?
I think in our isolated localities that's more than likely, particularly where it would be almost impossible for people to be able to sustain themselves for 14 days. However, there will be cases that may well be able to do that. Some of the cattle stations, for example, have individual separate housing blocks on their homesteads, and again they may well be able to be self-sustaining. Our key concern, of course, will be how potentially quickly a person can deteriorate, and ensuring that they're as close to appropriate medical provision as they possibly can be.
Thanks, everyone.
Thanks, everyone.
Thank you.